Hi everyone, I'm Kathleen Anderson, physical therapist, and it is National Fall Prevention Week, and I'm going to be doing a series of videos to discuss about fall prevention, and we're going to do episode 1 called Medication Safety 101. Did you know that medications is one of the most common cause of side effects of falls, and is one of the best things we can do to control the amount of falls that we have is knowing how to manage our safety of medications. So today what we're going to do is going to discuss the side effects of medications, how we can organize our medications, and begin that open dialogue with our healthcare providers, particularly our doctors, and how we can manage our medications better. So today, let's talk about different types of medications. Did you know there are many medications out there that cause significant amount of side effects that affect our way of thinking, our coordination, our balance, and there are things that we take every day for medical reasons that can cause significant difference in how we move. So there are drugs that are called benzodiazepines that are drugs that affect our brain function. And those are drugs that are consider help anxiety, help a calming effect. Those are drugs that you may know that help anxiety, like Ativan and Valium. People take those maybe every day, maybe occasionally. They help affect our brain a lot. Then there's non-benzodiazepines. Those are drugs that affect our thinking and our balance, okay? And maybe people take those, you may heard for Ambien or Sonata. Maybe you heard people sleepwalking for Ambien sleepwalking. And they don't remember they were sleepwalking. Well, those are common causes of falls as well. There are anticholinergic drugs. Those are drugs people may have taken for overactive bladder or for vertigo. They affect your balance and coordination. They're also used in over-the-counter drugs, such as Benadryl or Tylenol PM. How many have taken those to help you sleep? Those are drugs that are also taken as well. There are other drugs called antipsychotic drugs or mood stabilizer drugs. People who are on antidepressants, people who take them for Sonata, those are another drugs to help people for common effects, mood stabilizing. If you are taking drugs for pain medication, particularly if you had surgery, known as opiates. We have drugs that are known for morphine, hydrocodone, oxycodone, particularly with acetaminophen. If you take tramadol, which is another lower dose of opiate, that still causes discoordination, cause you to have unsteadiness, drowsiness, sedated feeling. That can also cause some affect your balance and make you fall as well. If you take drugs for common things that for medical conditions such as blood pressure medications, if you have hypertension, will be put in large doses. As a result, will decrease your blood pressure quite significantly, and sometimes you can bring it down too low, causes an effect called orthostatic hypertension. And as a result, if you get up too suddenly from lying down to sitting to standing position, it drops really significantly and you get that woozy effect. And as a result, you want to sit down immediately. Those dosage can be adjusted by your physician. And if you're starting to get those episodes quite frequently, you may want to discuss your doctor about adjusting your blood pressure medication. Another medication that's commonly used is handling your blood sugar. 25% of our older adults have either pre-diabetes or diabetics, and they are either drugs for metformin or Humalog for their insulin. And as a result, if their blood sugar is extremely high and that drug is on there, they may result into a hypoglycemic effect, and blood sugar gets too low, and the result become very unsteady and lose their balance, and can cause a fall as well. Those dosage levels can also be adjusted as well. So having your conversation on your medication dosage and knowing those side effects is very, very important. So now you have all these medications. What do you do with them? How do you get it organized, Kathleen? Well, you look at all your bottles, you make a list. That's important. One of the things here I tell patients, this is a personal medicine list that was organized by the CDC. You don't have to use it, it's just a guide, it gets you organized. I'll try to get you a link to this so you can download it and use it as a guide. If you have a lot of medications, you can always use the back to it. But basically, you write down the name of the medication, the dose, the medicine, what is it taken for, and you also write who the doctor, what's the name it prescribed. You may have a heart doctor, you may have a regular family doctor, you may have a bladder doctor, but you want to know who gave you this medication and why you use it for. If you are allergic to medication, it's very important to write down the type of medication that you're allergic to and what kind of reaction, because you don't want someone prescribing a medication that you're allergic to. And also all the medical conditions. If you have high blood pressure, diabetes, osteoporosis, write down all your medical conditions. It's really important that people understand why you have certain medical issues. So just use this as a guide, and this is very, very helpful. So if you have all your medications, you want to get them organized. And that includes vitamins, supplements, herbals, that's important. Even medications that you use PRN, like Tylenol or even eye drops. Get them all together and organize it. So people says, well, ma'am, I like to have my medications all in one spot. I like to have my morning medications that I take in the afternoon, all my bottles in the kitchen, and then I like all my bedtime medications at my bedside. And then I have all my bottles there. Great, I understand you have a system. That's perfect. But how do you know if you've taken all those pills? Sometimes we forget, we get in a rush. And sometimes we're like, well, did I take that pill at lunchtime or did I not take that pill? Best way I tell people is get yourself a nice little pill box. Sometimes getting it organized, setting it up for the week, Sunday through Saturday, you get it through morning, noon, evening, and bedtime. Get it all filled up, get it organized, then you can know you can take your pills, and if it's empty, you know you're taking your pills. But if you have a system where you want to just set up all your morning and afternoon pills and set it up in the kitchen, then you have that system. Then you can take your evening pills, set it up for your bedside, fill those up, and set one up at your bedside. Because then if it's empty, you're taking your pills. If it's filled, then you know you have to take your pills. But at least you know it's safely organized and you don't have to worry about it. Try to read some of these labels. I understand it can be very, very frustrating. My best tip here is take a highlighter, highlight it, then you can see it. Make sure you read everything here, including the expiration date, see if there's any refills. Then get a magnifier, and that helps you make sure you're looking at the correct medication and make sure it's legible. They're also very important to make sure the medication has not expired. If it's expired, get rid of it, particularly if it's antibiotics. Now, you should have completed all the antibiotics regimen. Don't save them for a rainy day, but it's also important to not continue taking medications that have expired. People sometimes hold on to medications like, I might need that later on. No, because the interaction of an expired medication can do harm to your body. If you have opiates in your home that you no longer need to use anymore and you do not want to keep them in your house, contact your local pharmacist, find out where you can get rid of them safely. Do not dump it into your toilet. You contaminate the water supply. Find out from your pharmacist if there's a safe place where you can dispose. Also, you can contact your local law enforcement agency because sometimes there are safe drop-off points where they get rid of non-usable opiate places where you can get rid of it. Because again, if you do not want to keep them in your home and you don't want somebody to get to them, it'd be very important that you get rid of the opiates safely. Also, another thing to keep in mind, any supplements herbals, medications such as those sometimes do not interact well with your prescribed medications. It's important that you understand that the side effects and drug interactions is important. If you're not sure if your supplement will interact correctly with your prescribed medication, contact your doctor and speak to the nurse there and see with the drug interaction. If you can't get a hold of your doctor, contact your pharmacist. Again, they are a great resource to find out if the drug interaction with the supplement is going to be compliant to your body. Personal action plan. This is a nice little form here from the CDC, and again, I'll get you the link here. But this is a good way to have a good conversation with your doctor, and particularly with your medications. What is this medication used for? Does this medication interact with the others and what I'm taking? Could this medicine have side effects that might change my ability to drive safely or increase my risk of falling? Is there any other medication that I should be taking or try that could be a little less side effects? And is there any way, what would happen to my body if I stop taking this medication or if I change my medication? Don't stop a medication without consulting with your physician or contacting the pharmacist, because if you do stop taking abruptly, you could cause more harm than good, and the side effects sometimes can be very, very harmful, particularly if you need to do it at a taper effect, because the taper effect, it'll take a little bit longer to leave the body through your system, and we don't want you to fall in the process. I hope this information has been very helpful for you, and I look forward to sharing more information during this National Fall Prevention Week. Stay tuned for further episodes in the week on fall prevention, and you have a great day.